All right, today we're putting on our detective hats for a medical mystery where every single second is critical. We're going to dive into a case file, piece together the clues, and see if we can save a life. You ready? Let's get right into it.
So here's the deal. The stakes are as high as they get. We've got a patient who's unresponsive and that clock is ticking fast. The key to solving this, the thing that saves them, is hidden right there in the symptoms. Your job is to find that one little piece of evidence that just blows this whole case wide open.
Okay, here's what we've got. This is our evidence. The patient is totally out of it, unresponsive. Their breathing is dangerously slow and shallow. We're talking just 6 breaths a minute. And their heart has slowed way down to 50 beats per minute. These 3 facts, that's all we have to go on.
Now, at the scene, investigators found 4 very common medications. So think of these as our 4 main suspects. One of them is our culprit, for sure, but that means the other 3 are red herrings.
So let's meet the lineup. We have aspirin, ibuprofen, acetaminophen, and codeine. What's really crucial to see here is that each of these drugs in an overdose goes after the body in a totally different way. They each have a specific target. Our whole mission is to figure out which one of these signatures matches the clues from our patient. All right, the investigation officially begins. We're going to go one by one and compare each suspect's known overdose signature with the evidence from our patient. It's a classic process of elimination.
First up to the plate, aspirin. It's a pain reliever found in millions of homes. But could it really be our culprit here? Let's see if its story holds up.
And whoa, right away we have a huge problem. Our patient's entire system is slowing down, right? But an aspirin overdose does the complete opposite. It kicks the system into overdrive. It causes something called metabolic acidosis, which actually makes a person breathe faster and faster to compensate. It's a total mismatch. So, aspirin is officially off the list, ruled out. Let's not waste any time and move straight to our next suspect, ibuprofen.
Okay, an ibuprofen overdose is no joke. It can do serious damage to the stomach lining and the liver. But think back to our patient's clues. Their problem isn't just 1 or 2 organs in trouble. It's a total system shutdown, a central nervous system depression. That's just not ibuprofen's typical move.
And that's 2 suspects down. Ibuprofen just doesn't fit the picture. So we're on to suspect number 3, another super common one, acetaminophen. You probably know it as Tylenol.
Now, acetaminophen is famous, or maybe infamous, for one thing in an overdose. It causes catastrophic damage to the liver. It's a very targeted attack. But once again, it doesn't explain our patient's main symptoms, that unresponsiveness and the severely slowed breathing. It just doesn't cause that kind of shutdown of the body's control center.
And just like that, 3 suspects have been cleared. We used pure logic and evidence, and now we're left with only one possible answer. The drug that has to be responsible for this patient's condition is codeine.
So we've identified our culprit, but a good detective always proves the case beyond a shadow of a doubt. Let's break down exactly why codeine, which is an opioid, is such a perfect, undeniable match for everything we're seeing. It all comes down to this one key concept, central nervous system depression. So think of it like this. Opioids essentially get to the body's main control center, the brain, and just tell it to slow everything down. And when that control center slows down, all the vital functions it controls, like breathing and heart rate, they slow right down with it. It's the classic signature of an opioid overdose. And this is where it all just clicks perfectly into place. Let's line up the evidence. First, altered mental status. Our patient is unresponsive. Check. Next, hypoventilation. That's just the medical term for slow, shallow breathing. Our patient is at 6 breaths a minute. Check. And finally, bradycardia, a slow heart rate. We've got 50 beats per minute. Check. It's a textbook match, right down the line. So, the case is closed. We've got our drug, we know the mechanism. But before we finish, let's just zoom in one last time on that single most important clue that was pointing us in the right direction from the very start. 6. Just that one number, 6 breaths per minute. A healthy person is breathing at least twice that, usually way more, like 12 to 20 times a minute. This number isn't just a symptom, it's a giant flashing red light that screams that the body's most basic automatic function is failing. That was the smoking gun. And hey, this isn't just our clever deduction. The clinical source material confirms it, crystal clear. It states, quote, "Of the drugs listed, codeine is the most likely cause of this patient's clinical presentation." It really doesn't get more definitive than that.
So, you did it. You solved the case. But it kind of leaves you with one last big thought, doesn't it? We live surrounded by these substances. They're in our medicine cabinets right now. What this really shows is that understanding what they do and what they can do in the wrong situation is more important than ever. So the question is, the next time you look in your cabinet, will you know what you're really looking at?